Hey everyone, and welcome back to the channel. I've got something critical to discuss today that directly impacts the health and financial well-being of families across the United States. What if I told you a disease officially eliminated from our country over 2 decades ago is making a dangerous comeback? We're talking about measles, and its resurgence is a stark warning that we simply cannot afford to ignore. As of mid-June 2025, the U.S. has confirmed over 1,200 measles cases across at least 34 states and the District of Columbia. This alarming figure puts us on pace to exceed the 2019 total of 1,274 cases, which was the highest number reported in a single year since measles was declared eliminated from the United States in 2000. It's a shocking reversal that demands our immediate attention. The biggest outbreak, acting as an epicenter, is in West Texas, which has alone seen around 750 cases across 35 counties. This includes Gaines County, where the virus began spreading in a close-knit, under-vaccinated Mennonite community, accounting for 413 cases, nearly 2% of its residents. While cases in West Texas have recently slowed thanks to increased vaccinations and public awareness, authorities are tracking more outbreaks elsewhere. New Mexico, just east of Texas, has logged 81 cases, mostly clustered in Lea County, with some rural communities near Albuquerque also seeing infections. Kansas has reached between 72 and 76 cases, with a significant portion involving children under the age of 5. North Dakota currently holds the highest per capita rate nationwide with 34 cases, marking its first measles cases since 2011, primarily in Williams, Grand Forks, and Cass counties. Iowa recently announced its first outbreak of the year, bringing its total to 6 cases, primarily from household contacts in eastern Johnson County, all stemming from an unvaccinated child exposed during international travel. Colorado has reported 16 cases, including an outbreak linked to international travel through Denver International Airport and a Turkish Airlines flight, where some fully vaccinated individuals were exposed during travel to Europe. Georgia has confirmed 6 total cases, with a recent outbreak of 3 in metro Atlanta, and Illinois has seen 8 cases, with an outbreak in the southern part of the state. Other affected states include Arizona, Montana, and Oklahoma, with outbreaks in Indiana, Michigan, Ohio, Pennsylvania, and Tennessee having been declared over after 6 weeks of no new cases. So why is this happening? The primary driver behind this resurgence is a significant decline in vaccination rates. The Centers for Disease Control and Prevention, or CDC, recommends a 95% vaccination rate among kindergartners to achieve community immunity, often referred to as herd immunity. This high threshold is crucial because it protects the entire community, especially those who are too young to be vaccinated, like infants, or who are immunocompromised. Unfortunately, national MMR vaccine coverage for kindergartners fell from 95.2% during the 2019-2020 school year to just 92.7% in the 2023-2024 school year, leaving approximately 280,000 young children vulnerable. This decline is exacerbated by vaccine hesitancy, which has been amplified by misinformation and political polarization, alongside disruptions to routine immunizations that occurred during the COVID-19 pandemic. This trend aligns with global patterns, as worldwide MMR vaccination rates fell to a 20-year low in 2021, while international travel from regions facing large outbreaks like Canada, with Ontario with 2,179 cases, and Alberta with 996 cases, and Mexico with Chihuahua with 2,335 cases, is reintroducing the virus into the U.S., the domestic spread among unvaccinated populations is the main issue. In fact, more than twice as many measles cases have come from outside the U.S. this year compared to last, mostly from unvaccinated Americans returning home. Undervaccinated strongholds such as certain religious or homogenous communities are fueling the spread within the U.S., mirroring outbreaks previously seen among Orthodox Jews in New York and Amish communities in Ohio. The human consequences of this trend are tragically severe. This year, we've already seen 3 confirmed measles deaths in the U.S., 2 elementary school-aged children in West Texas, and an unvaccinated adult in New Mexico. All of these fatalities occurred in unvaccinated individuals. The 2 children in Texas, an 8-year-old and a 6-year-old, died without underlying health conditions. For context, before the MMR vaccine program started in 1963, an estimated 3 to 4 million people were infected with measles each year, leading to 48,000 hospitalizations and 500 deaths annually. Measles isn't just a rash. It's a highly contagious airborne virus that first infects the respiratory tract and then spreads throughout the body. It can lead to dangerous complications such as pneumonia, which develops in about 1 in 20 children, brain swelling, encephalitis, permanent hearing loss, blindness, and even death. Alarmingly, up to 3 of every 1,000 children who become infected may die from respiratory and neurological complications. About 1 in 5 unvaccinated people who get measles will be hospitalized, and none of the confirmed cases that led to hospitalization this year had documented evidence of receiving 2 doses of vaccine. Overall, 12% of cases have resulted in hospitalization, increasing to 21% for children aged 5 and under. This virus is incredibly contagious. A single infected person can spread it to 12 to 18 others, and the airborne particles can remain infectious in the air or on surfaces for up to 2 hours after an infected person has left an area. The symptoms typically appear 7 to 14 days after exposure, starting with a high fever, runny nose, cough, and red watery eyes. Tiny white spots, known as Koplik spots, might appear inside the mouth 2 to 3 days after the first symptoms. This is then followed by a characteristic red blotchy rash that begins on the face and spreads downwards. An infected person can spread the virus for about 4 days before and after the rash appears. Furthermore, measles can weaken the immune system, leading to a phenomenon known as immune amnesia, making individuals vulnerable to other infections for up to 2 years afterward. This long-term vulnerability can potentially raise death rates beyond the initial illness. The good news is prevention remains highly effective. The MMR vaccine is the best protection against measles. 2 doses are approximately 97% effective at preventing measles, and even 1 dose offers about 93% protection. If you're unsure of your vaccination status, especially if you were immunized before 1968 with less effective killed virus vaccines, or even if you received a live measles vaccine in the 1960s but have concerns about waning immunity, it's harmless to get another shot. Health authorities recommend adults check if they need a booster, especially if planning international travel. People born before 1957 generally have presumptive immunity due to widespread natural infection back then. Measles vaccine is required for entry into Iowa public and private schools, as well as licensed child care centers and preschools, greatly reducing risk when requirements are followed. The CDC also recommends that children receive their first MMR dose between 12 and 15 months of age, and the second between 4 and 6 years old, with early or accelerated doses recommended when exposure risk is high. If you or someone you know has been exposed to measles or develops its symptoms, it is absolutely crucial to isolate yourselves immediately and call your healthcare provider, urgent care, or emergency room before arriving. This critical step helps prevent further spread, especially in healthcare settings where vulnerable individuals may be present. There is currently no specific treatment for measles. Doctors can only alleviate symptoms and manage complications. Therefore, prevention is key. Public health agencies are working to strengthen their response, leveraging clinical surveillance technology for real-time identification and tracking of cases, which is essential for timely action. This includes integrating data from electronic health records, configuring real-time alerts for public health officials, and streamlining reporting to local and national agencies. Health authorities emphasize the importance of collaborative efforts with trusted community messengers like healthcare providers and local leaders to increase vaccination rates and promote culturally competent public health measures. Healthcare providers, particularly primary care physicians, play a vital role in engaging parents in ongoing, respectful conversations to address fears and misinformation, as pushing too hard can be counterproductive. Refusing care to families who decline vaccines is not proven effective. Instead, repeated, empathetic discussions can gradually change minds. This measles resurgence is truly a canary in the coal mine, signaling a broader population vulnerability to vaccine-preventable diseases. Protecting our communities means ensuring everyone is up to date on their vaccinations and trusting public health guidance based on science and research. The decision to vaccinate is a personal one, but it impacts the entire community. Consulting with your healthcare provider to understand your options, risks, and benefits is highly recommended. Thank you for watching, and I hope this information helps you make informed decisions for your family's health and safety. Please take care of yourselves and each other. See you next time.